Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
And let me just go back. I'm looking at Christina, I guess, who's asking about the goals. Christina, are you sure that you want to focus on academic goals versus things that might be functionally more useful to him? So keep in mind, it doesn't have to be academic, the stuff that you're asking for the school to do. Like, for instance, teaching an individual to wait is not necessarily an academic goal, but it's a pretty important one. Teaching an individual to communicate using some augmentative system.
And he's got an ACC
device. Let them load up the goals on that, because that is like really, really important.
Okay, and she says that was a typo error, sorry.
Oh.
Because AAC. But yeah, and I'm a little frustrated right now because we've been getting a lot of calls about really ridiculous things being said in IEP meetings.
Okay.
It's IEP season, and I'm a little like, I kind of want to pop off here. I won't. But here's the thing, is that wherever your child is, right? If we start with an AAC device, and maybe we start with the iconic, and we do the picture exchange system, and then we work to the AAC device. But then let's say that they've got 5 words on the AAC device. Then we can go to 10 words, and then we go to 20 words, and then we can go to typing.
Right.
There's always,
exactly.
And I find that schools a lot of times go, well, we did the AAC device, and we got 10 words. Our work here is done.
Not even that. Like, I think sometimes what they'll do is they'll say he's not using his AAC device.
Right. So we put it away.
Right. So it's not a functional thing. Whereas really they're doing something wrong, because everybody wants to communicate. You need to make it possible for the child to use like, for instance, for your child, does he actually use his AAC device all the time?
Yeah.
To communicate, which would be very important.
And I think it's really important for us as parents to know that everything is like on this continuum. And so once your child meets one goal, then we move on to the next goal. And a lot of times the school gets a little lazy and they go, well, we completed this OT goal.
Yep.
I have somebody writing into me right now that the child has CP and is mildly affected in their hands, so handwriting is hard. So they've been typing.
Yes.
And the child can type with one finger 10 words a minute, and they're like, so we can get rid of the OT. And I literally want to light my hair on fire. I'm like, that is not, no.
Right.
Now we work to get, 20 words a minute, and we start using 2 fingers.
Right.
Like, really?
Yeah.
You're done?
Yeah.
And I've heard from multiple parents lately saying that the school has said to them, well, we've done everything we can considering their disability.
Right.
Just light my hair on fire.
Right,
I have very little fodder right now, but light it on fire. We have to push as parents and say to them, no,
Right.
we continue to get progress.
Exactly.
Yeah.
Exactly.
So, don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.